Okay, do I have everybody here? Good morning to all. I'm Congresswoman Rosa DeLauro, represent the 3rd District of Connecticut. And first and foremost, let me just say a thank you to Mayor Tony Harp, the mayor of the city of New Haven. And while Tony would have loved to have been with us this morning because she is really so concerned about these issues and the issues of gun violence. But I want to say a thank you to her for her commitment on these issues, but also to say thank you for letting us use your house today in this wonderful place. And I always say when I get here, can't wait the day to see Mayor Tony Harp's picture on these walls, okay, so that we can make a gender change here in this place here. So I want to just say a thank you to all of our distinguished guests who have joined us today. Brent Peterkin, who is the statewide coordinator of Project Longevity, Dr. Carl Minguez, Associate Research Scientist at the Yale Center for Outcomes Research and Evaluation, Dr. James Doddington, Assistant Professor of Pediatrics and Emergency Medicine at the Yale School of Medicine and an attending physician in the Pediatric Emergency Department at Yale New Haven's Children's Hospital, Jeremy Stein, Executive Director of Connecticut Against Gun Violence, and we have Melissa, who is with us from the Connecticut Against Gun Violence, but we all have a whole bunch of folks who are out in force here for us. And thank you for your advocacy and this effort. And we have Poe Murray, Newtown Action Alliance, and we have Kristen Song, who has the mother of Ethan Song and responsible for the passage of the Connecticut legislature on both the House and the Senate of Ethan's law with regard to gun storage. And thank you for being here with us this morning, Kristen, and thank you for all of your efforts. And Pina, thank you to you as well. Alongside of these researchers and advocates, what I'm here to do is to highlight the resources. I guess translated that means the funds, the money, that we are securing in the Congress to be able to conduct public health research into the epidemic of gun violence. We held a press conference in early March, and so many of the folks who are here this morning were here at that time. I believe it was March 11th when we held our press conference, and we were talking about how important it was to be providing funding for what is a public health emergency in our country. And what I'm here today is to say that we are strong in keeping our word to Connecticut families. It's a united front, advancing funding for public health agencies to research, again, this public health emergency. Gun violence is a particularly important issue for us in Connecticut. It was, we know the date, December 14th. We know that date so well in our hearts. The unspeakable happened in Newtown. We lost 6 wonderful, caring adults, and we lost 20 children. We lost 20 babies. And while the time has passed, we have refused to let the memory of that fade from our heart, nor has the bloodshed left the news. There have been more than 2,000 mass shootings since Newtown. And with that, let me also recognize Poe Murray, who's the Newtown Action Alliance. Thank you, Poe, for all of your efforts. There can be no debate. The epidemic of gun violence is that public health emergency. Yet, we are not conducting the type of research that we need to deal with this issue. You know, sepsis killed about as many people as gun violence. That is according to a review in the peer-reviewed journal of the American Medicine Association of CDC. This is the mortality statistics. Yet, despite similar rates of mortality, sepsis has received 150 times the research funding than gun violence. We are all trying to focus our attention in the House of Representatives to address this issue. I'm in the fortunate position of being chair of the subcommittee that funds the National Institutes of Health and the Center for Disease Control and Prevention. On March 7th, we held a hearing, and I might add, the very first hearing we held in 20 years on the issue of gun violence research, prevention research. It was the very first one. We brought in experts from the research-focused RAND Corporation, the American College of Surgeons, Johns Hopkins Center for Gun Violence, and they told us that there is a need for this research, and there is the authority for doing so. And the administration agreed. Both the Secretary of HHS, Secretary Azar, and the Director of the Center for Disease Control have told us this is what the head of the Department of Health and Human Services said. We're in the science business and the evidence-generating business, and so we'll have our agencies certainly working in this field, as they do across the broad spectrum of disease control and prevention. The director of the CDC, Dr. Robert Redfield, said, and I quote, "We don't have any restrictions to do the research. We just need a funding mechanism. We're poised to research in this area if Congress chooses to give us the additional funding." Well, Congress, this committee, and Labor HHS, the Subcommittee of Appropriations, in the subcommittee and in the full committee, we said yes. And as we promised in March, we are securing that funding. Last week, we passed the funding levels for the next year for the Center for Disease Control and Prevention and also for the NIH. We provide $25 million to CDC, $25 million to the NIH to fund the research into gun violence, the activities that will have the greatest potential health impact. And that includes strengthening data collection, because only by better understanding firearm injuries and deaths can we better prevent them. This money can go a long way, and it must. We need to better understand the correlation between domestic violence and gun violence. More than half of intimate partner homicides involve the use of firearms. We need to better understand how to help those Americans who choose to own guns to do so in a way that keeps their family safe. Research has indicated that safe storage is effective in reducing the number of children harmed by guns. And I'm proud to say that just a few days ago in Washington, in the House Triangle with the Capitol in the background, we held another press conference about the introduction of Ethan's Law at the federal level. We introduced it because Kristen's son, Ethan, lost his life in early 2018 in a gun accident when he was at a neighbor's home and when the guns were in plain sight, actually, and his youngsters were playing with him, and he accidentally shot himself and died. In the State House, as I said, last night the State Senate voted 34-2 on a bipartisan basis. Prior to that, you tell me it was 27-2 in the House, 127 to 16. 128. Okay, let's keep those numbers going. To tell you the strength of this issue on gun storage and the bipartisan nature of it. It's what we are attempting to do at the federal level with my colleagues in the Senate, Senators Blumenthal and Murphy, introducing that legislation, Ethan's Law, in the Senate. And just as I said last week, my colleague Jim Langevin of Rhode Island and myself introduced the bill in the House of Representatives. We need to better understand interventions to reduce suicide by firearms. Sadly, suicide accounted for nearly 24,000 deaths in 2017, and firearm suicide rates have risen steadily since 2006. This is especially true with regards to our veterans. They are twice as likely to die by suicide as the general population, and 2/3 of those veterans who died used a gun. This is an issue that is of central importance to our community, to Connecticut, and to our country. And we need to be dedicating public dollars to research the epidemic of gun violence, as we would do with any other public health emergency. And as representatives in charge of funding for both the NIH and the Center for Disease Control and Prevention, we are going to push this to make it happen. It is a pledge that I make. This bill that we introduced will be on the floor of the House in mid-June. It then goes to the United States Senate. Now, we can pass this bill in the House of Representatives because we are in the majority. We are not in the majority in the Senate, and I'm asking all of the advocates, all of the people who care deeply about this issue, to make sure that United States senators, not our two, they're the best, and they have been fighting this issue, but others who need to hear from families and people and advocates all over this country to say that let us pass this legislation and these dollars for research. So thank you. It's now a great pleasure for me to introduce our speakers. And we're going to start with Brent Peterkin, statewide coordinator for Project Longevity. It was an initiative in Connecticut uniting law enforcement agencies and communities in reducing violence and arrests by increasing supports and social services. It's been recognized nationally and internationally for its efforts and impacts. Brent has been recognized as a leader, including as a 40 under 40 honoree by Connecticut Magazine. He serves on the Governor's Youth and Urban Violence Commission, co-chairs the Bridgeport Mayor's Initiative for Reentry Affairs, and is a board member of Connecticut Against Gun Violence. Brent, happy to hear from you.
Good morning. I'd like to start by thanking Congresswoman DeLauro for her strong advocacy on this effort and pushing her colleagues in the United States Congress to support research funding for CDC and NIH efforts to make sure that we are informed as a country on the impact and opportunities to prevent gun violence. I'd also like to express my sincere and extend my sincere gratitude to the advocates who've also joined us today, and also thank them for their efforts in making sure that we are working in cohesion and consistently and persistently to focus on gun safety and gun violence. You know, in America, gun violence impacts 100 Americans every day. Every day we see almost 100 people die in this country as a result of gun injury. And that's over 30,000 people a year, right? If any other health-related issue reached this level, then you would see an amplification of awareness, an amplification of research funding, yet we lack that when it comes to gun violence intervention and prevention and safety efforts. When you examine the Dickey Amendment and you look at what it actually states, it actually doesn't prohibit the CDC from researching gun violence or NIH from researching gun violence. But what it is it actually defunds it. It doesn't provide the necessary funding for those institutions to make sure that we are informed comprehensively on how gun violence impacts our society. And essentially what it boils down to is corrosive political culture that construes policy in a way that prohibits us from moving forward on such an issue that negatively impacts us all. You know, when we examine the rate of gun violence injury, it requires a sober reflection, right? We have to make sure that we're doing everything that we can and encouraging our political leaders to refrain from being intoxicated from ideology that prohibits us from moving forward as a country to address gun violence. The work that I do focuses on the type of gun violence that occurs typically in Black and brown communities. I address street gang gun violence and street group gun violence. And it's something that often doesn't get the necessary amplification and promotion in the media that's necessary for such a serious issue that affects communities all across the country and communities right here in the state of Connecticut. When you think about the type of gun violence that occurs in urban communities, the street gun violence that we see in our communities, we have to look at it in a holistic manner, and we have to look at comparatively to other forms of gun violence. As we consider the father in Newtown, Jeremy, who committed suicide, and we think about the Parkland students who committed suicide, and we consider survivor remorse, we consider the impact of trauma, we must also examine the people in Black and brown communities who are also impacted by gun violence and how this affects them psychologically. These are questions that we should be supporting research through funding to explore and investigate and to provide substantive data and inference based upon that data to inform our political leaders and also to inform advocacy efforts. As we consider the rate of gun violence in urban communities, and we think about street violence and we think about the perpetrators of violence, we have to take into account that by and large, the majority of people who are involved with driving acts of violence were first victims, right? And so if we look at whether it's bullying and access to firearms and that resulting in mass shootings or suicide, or we think about street group gang violence and how that plays out in urban communities, we have to look at and examine and look at the individuals who were first victims and whether or not we have enough evidence-based research to support viable and prudent treatment efforts to make sure that there's a cessation of violence, that we're actually getting out to victims and making sure that those victims do not become offenders or individuals who pursue self-harm. As someone who has been personally affected by gun violence, I myself has been shot at. I grew up in a city where gun violence was very prevalent, and I'm exposed to that on a regular basis through my work here in Project Longevity in Connecticut. And one of the things that I can tell you that gun violence does is it causes a sense of hypervigilance, right? And so, you know, I think back to my childhood and I think about my days in school, and one of the things that I look forward to, and I'm a little bit ashamed to say this, is that I look forward to fire drills, right? It was an excuse to get out of class, and we had no fear that the building was going to burn down. It was just a way to get out of class, hang out with our friends for about 30 minutes, and then we make our way back in. And as someone who has a child that attends school in the state of Connecticut and has children who've attended public schools in Connecticut, I'm taken aback by the fact that they now have active shooter drills, right? And that's not something that they can look at it with jovial expressions and say, hey, we get to get out of class. What it does is it drives a sense of hypervigilance amongst our kids. We need research that's going to be funded and supported to examine how that affects our young people in all communities. Right? We have to look at that and how that impacts their prospects and their outlooks on life and how that may deteriorate their mental well-being. I think we also need to make sure that we're encouraging our elected officials and advocates across the country to consider the impact this has on our public health and public safety communities. You know, more police officers die from suicide than they do in the line of duty. Are there corollaries? Are there correlations when you look at officers who do work in high crime, high violence neighborhoods with officer wellness and well-being, right? Officers and first responders and also people in the medical community often see the heinous results and egregious results of gun violence. They're often there when someone takes their last breath or someone begs them to do everything that they can to save their lives. How does that affect communities? How does that affect people who are first responders? How does that respect the medical community? When we think about physician burnouts and physician suicide rates, when we think about ED and trauma nurses and how that may affect them as well, in addition to family members. I think we also have to take a look at suicide, and we have to look at that because it is a huge issue in this country that often gets overlooked. And we need to make sure that there's more funding through research, funding CDC and NIH to explore this in a much more meaningful and deeper way, and that needs to be supported through the Senate. And we need advocates to stand strong on that. You know, we tell parents and we tell people who are prescribed opiates to make sure that they safely store their medications. We want to keep that out of reach of young children and people in their households. You know, I'm proud to say that Ethan's Law was passed in the state of Connecticut through its legislator to ensure that firearms aren't negligently stored, whether in an automobile or in a home, right? Because it's common sense. If we can make those type of considerations when it comes to opiate drugs, we need to extend those considerations nationally when it comes to firearm storage and safety. We also have to consider the impact of state violence. You know, recently in the state of Connecticut, we had use of force incidents that has caused great outrage in communities throughout this state. We have to consider whether it's a justified shooting or a shooting that's not justified. We have to examine the impact of violence and state violence through use of force incidents on how that affects the psyche of individuals who live in communities of color. When I was growing up, I was implored to be respectful and civil when I interfaced with an officer of the law. That's the way I was raised. But I was also cautioned to be as docile as possible to not provoke an officer of the law. Now, I'm not disparaging law enforcement, and I'm not trying to cover this with the white blanket. But the reality is that use of force incidents do have a ripple effect in how communities respond and how we comport with law enforcement. I think we also have to make sure that we are funding research efforts that will inform the medical community and improve its efficacy, whether it's treating gun injuries, and we had the healthcare community speak out when Parkland happened, and we talked about the impact of assault rifle ammunition and the damage that it does to internal organs once a round pierces the flesh, and their inability to repair someone's body and potentially save lives. We have to fund research efforts that's going to support opportunities for us to explore the efficiency when it comes to first responders responding to incidents of gun violence, whether it's suicide attempts, mass shootings, or street gang gun violence that occurs in our communities. The work that we do through Project Longevity focuses on prevention and intervention efforts. But when someone gets shot, oftentimes it's a game of chance. How proximate are they to a healthcare facility, and the nature and the damage of their gun injury and the ability for those physicians and healthcare workers to save a life. You know, I work with young people and also adults who've been impacted from gun violence. And I could tell you firsthand that it can erode one's self of agency. It can distort one's perception of their prospects on life. This is something that needs to be taken very seriously, right? And to ensure that we are comprehensively examining and exploring every detail, every data point, and every aspect through funding research that supports CDC and NIH efforts when it comes to gun violence. That we are not leaving community of color out of the equation, that we are considering suicide, intimate partner violence, accidental shootings, state violence, and also mass shootings as well. So I'd like to say in closing that, you know, amongst developed countries, the United States stands out with its rates of gun violence. And we are in position here to reconsider or to consider our global leadership on this effort. We saw the position that New Zealand took when they had a mass shooting, and they were able to expeditiously pass bills and legislation that supported gun safety and gun violence prevention efforts. We have the opportunity to make sure that we are as informed as possible through supporting the CDC and NIH. We must consider the potential impact for this research to save lives. I urge everyone who is in earshot or viewing this broadcast to get out there, engage their senators, engage their members of Congress that represent their districts and their states, call them, write a letter, email, reach out to their legislative aides, show up at their town halls, amplify the cry to support gun violence research and funding to CDC and NIH. I would also add that it's prudent, it's serious, and it's important for all of us to not be ignorant on this issue. Now, we suffered by not having significant research efforts to drive our thinking when it comes to gun violence. But this is the information age, right? Willful ignorance is inexcusable. We all have access to the internet. Do the research. As a citizen of this country, as a citizen of the state, it is imperative that you take time out to research this issue and to make sure that you are informed. And you take that information and you bring that to your elected officials and you push them and you encourage them to support funding. Thank you.
Thank you. Thanks very, very much. Thank you. Great. Let me now introduce Dr. Carl Minges, Associate Research Science at the Yale Center for Outcomes Research and Evaluation. He's been recognized for his contributions by the American Heart Association, the Society for Behavioral Medicine, and Yale University, an expert on improving the health populations of vulnerable clinical populations. He is going to be talking about how public health research would work and what it would produce in the way of actionable solutions. Dr. Minges.
Thank you very much for having me. I'll set the record straight that I'm actually with the University of New Haven. Okay. So not to ever correct Rosa, but So that's who I'm speaking on behalf of today. So first, I'd like to commend Congresswoman Rosa DeLauro and her colleagues for advancing the potential of gun violence research to be funded by prestigious government entities, including the Centers for Disease Control and Prevention, as well as the National Institute of Health. It is one giant step in the right direction to better secure the public's health and safety, so thank you very much. As director of the University of New Haven's Master of Public Health program, I instill in our students the future of public health, that public health is about prevention. It is about protection. It's about helping the most vulnerable in our society to lead better lives. Public health is about making communities healthier, developing sensible and sustainable evidence-based interventions and policy solutions to the pressing problems of our time. Public health research is not partisan. In this field, we are simply looking for ways to solve crises to allow all people to live lives fully, safely, and with minimal risk. As public health researchers, the stewards of very precious taxpayer resources, it is our responsibility to make meaningful use of available research funds, such as those of the NIH and CDC, to understand, predict, intervene, and develop sustainable public health policy solutions to the epidemic of gun violence, a completely 100% modifiable problem facing our society. First, it's shocking that so little basic descriptive research exists on this topic, since the federal government has not tracked firearm injuries in any systematic way over the past 2 decades. The gun-related estimates of morbidity and mortality result from small convenient samples of hospitals, translating to very imprecise and unreliable data. Thus, foremost, there's a need for a national public health epidemiologic system to track gun violence, much in the way that the government's fatality analysis reporting system closely tracks deaths from car accidents. This surveillance tool will give us more precise estimates of who is impacted by gun violence using which device and in which location. Very important information to know. Additional descriptive research questions employing both a quantitative and qualitative methodology can be answered by leading research institutions and researchers to help us understand the mediating and moderating factors of gun violence to better intervene and prevent. Such key questions include: why has gun violence increased over time? Which communities does gun violence affect differentially? What are the socioeconomic or socioecological correlates of gun violence? How could predictive analytics be best used to prevent gun violence? What's the correlation between other types of violence, like domestic violence, and gun violence? Frankly, we do not know the answers to these or other very basic questions, such as how many households own guns in the U.S., what types of firearms and how many guns are owned in households, and how do they store them in a secure location, if at all. As public health practitioners, we must understand these very issues to take a comprehensive, multi-pronged approach to address this ongoing crisis. This can help with the development of evidence-based interventions to effectively address the critical and complicated gun violence issues of our time. For example, what interventions could reduce suicide rates, especially among the veterans of this nation, who have among the highest? How can we help those who choose to own guns to store them safely? What works in preventing mass shootings from happening in the first place in our schools, places of worship, and community spaces? At local universities here in Connecticut, CDC and NIH funding mechanisms will avail unique approaches to understanding this topic that will ultimately provide strong and reliable data from which researchers can effectively study and provide evidence-based solutions to prevent gun violence from happening in the first place. For example, at the University of New Haven, researchers in the School of Health Science could collaborate with those from the Henry C. Lee College of Criminal Justice and the Center for Analytics to serve as the technical infrastructure for future research into gun violence. The Center for Analytics Information Systems and Analytic Support may be leveraged by subject matter experts in the fields of healthcare, law enforcement, and social policy to better understand trends in gun violence, identifying hot spots of gun violence activity. The Center for Analytics capabilities in data collection and encoding, which has supported the missions of the defense and federal law enforcement communities, may be employed to develop new databases to better study gun violence and lead to data-driven public health solutions and policy recommendations. In sum, appropriating CDC and NIH funds to research will allow us to examine the characteristics of gun violence, identify the protective factors and risk factors, as well as the mediators and moderators of gun violence. Use cutting-edge analytic methods such as social network analysis and crime mapping, and explore the effectiveness of gun safety education and technology to develop interventions. Once we know more about what it is and what works for gun violence prevention efforts, we can then develop better informed public policy solutions to reverse the deleterious trajectory of gun violence in America. Such policies could include a common sense licensing and education policies, requiring investment in safety precautions for gun owners, preventing dangerous individuals from owning guns in the first place, encouraging innovation of firearm personalization and safety, and enhancing mental health resources. Importantly, the target of potential gun violence prevention is not the Second Amendment, but rather it is in concurrence with the perspective of most Americans that responsible gun ownership with some restrictions is the proper policy. Gun violence is very much a public health epidemic that needs a public health response. Now that we as researchers, thanks to the House's efforts, and hopefully soon to follow the Senate's, we will have the opportunity to conduct epidemiologic and intervention research on gun violence prevention. As a country, we can begin to save lives, reduce harm, and stand taller than we were yesterday. Thank you very much for your time.
Thank you, Dr. Mingus, and I apologize, and you can, for, not talking about the University of New Haven, but as you talked about in your presentation, the work that you were doing with the Center for Analytics can be immeasurably helpful in how we press forward. So thank you very, very much, and thank UNH for its contribution to these efforts. Really much appreciated. So now I would like to welcome Dr. James Doddington, Assistant Professor of Pediatrics and Emergency Medicine at the Yale School of Medicine. I think I got that right. Attending physician in the Pediatric Emergency Department of Yale New Haven's Children's Hospital. His expertise and research include violence prevention with a focus on community-based participatory research, and he is the co-medical director of the Injury Free Coalition for Kids of New Haven. Dr. Doddington.
Good morning. I want to briefly add to the comments of my colleagues and my partners up here. My name is Jim Doddington. I'm an assistant professor of pediatrics and emergency medicine at the Yale School of Medicine, and I co-direct our injury prevention programs at Yale New Haven Hospital, just blocks from where we stand today. Today I'm speaking for myself as a health science researcher. I'd like to start by thanking Representative DeLauro for the opportunity to speak today and for the incredible movement in this legislation over the last few weeks. We know that firearm injuries and deaths in this country are a public health emergency. After decades in decline, firearm deaths are on the rise. Firearms kill about as many people in the U.S. as systemic infections, and I want to add to the same piece of statistics that Representative DeLauro had, and that those systemic infections are serious and critical. I don't want to detract from that, but research efforts around firearm injuries only receive 0.7% of the funding for this kind of work, mostly because of lack of opportunity for funding proposals from the CDC and the NIH. It is clear that the NIH and the CDC need more resources to address this critical gap in our knowledge as injury prevention researchers. My focus is on youth firearm injury prevention, and we know that in the U.S., on average, 18 children are hospitalized and 4 children die from firearm injuries every day. In order to improve these numbers, the CDC needs further funding to be able to study the epidemiology and to be able to fund opportunities for community-based projects to reduce firearm injuries. Here in New Haven, we applaud the work that is going on to address violence in our city through community-based initiatives, and we believe that through increased research funding, we can all benefit from evidence-based strategies to reduce firearm injuries, especially for our youngest and our most vulnerable. Thank you, Representative DeLauro, for your work to bring light to this issue, and to my colleagues up here, thank you so much.
Thank you. Engage your efforts as well, Dr. Doddington. Thank you so much. Let me now introduce Jeremy Stein, Executive Director of Connecticut Against Gun Violence. His expertise in gun violence prevention stems from his more than 23 years of experience as a litigator, worked on a number of gun-related cases as a prosecutor, with the Attorney General's office in the District of Columbia, where he worked on gun violence prevention. So delighted to have you with us today, Jeremy, and I know it was a late night. So,
Thank you, everyone. Good morning. Thank you, Congresswoman DeLauro, for always being a champion on this issue of gun violence, for making sure that we can sleep safer, and always trying to find a cure for this epidemic that we call gun violence. So thank you for doing this. Thank you for trying to provide the necessary funding so that we can study gun violence, because after all, if there were a disease yesterday that claimed the lives of as many children and family members that gun violence claims in the United States, we would be providing funding for that, to find the root causes of that, to find a cure for that epidemic. Yet we have failed to do so in the United States, and we are hoping that we can change that through this very important appropriations bill. So we, as the Congresswoman said, we had a very late night last night because we made history here in Connecticut. We were able to pass 3 gun violence prevention bills, 2 of which were safe storage, and 1 was a ghost gun and 3D printer ban. And these are common sense laws. And I want to thank some of the people that are behind me that helped us do that: Amy Pines, Brent Peterkin, Caitlin Clarkson Pereira, Poe Murray, Melissa Kane, and of course, Ethan's mother, and a hero of ours, Kristen Song. And through the hard work of our advocates and our supporters and survivors of gun violence, we had overwhelming bipartisan support for all of these bills. In fact, Ethan's Law, there were only 2 people in the Senate that voted against this bill. And we can do the same thing in Congress. We know in Connecticut we have led the way in gun violence prevention, and there is no reason why we can't do the same thing in Congress. So we are urging everyone to follow our lead, to come together as a country to study this, to make sure that we are providing the resources to study the root causes of gun violence and to find a cure once and for all for something that is affecting all of us. So thank you again.
thank you so much, Jeremy. Thank you all. Thank you. Let me now introduce as well someone who is a force of nature, and that's Poe Murray, chairwoman of the Newtown Action Alliance, which is an all-volunteer grassroots organization. It was formed after the tragic shootings at Sandy Hook Elementary School on December 12th, 2014. The Alliance works to bring about legislative and cultural changes that will reduce gun violence. And they are fighting for action to reduce gun violence. And it's indefatigable, the work, and they're everywhere to try to bring some sense to this issue. Poe, let me ask you this.
Well, we would like to thank and applaud Representative DeLauro for introducing the $50 million into the House of Representatives, and we will push the Senate very strongly as a grassroots organization, a national organization, and as a board member of the States United to Prevent Gun Violence with 33 state affiliates. We will work together with our national partners, and we will ensure that activists and groups all across the nation to encourage them to support this very important initiative. The CDC research shrank by 90% after the Dickey Amendment passed, which is really unfortunate because, as others have stated, gun deaths have increased in the recent years, and it's just simply unacceptable because there is something that can be done. And right now, Congress has demonstrated that they're not willing to move forward with any sensible gun laws, and partly due to lack of research that will demonstrate that evidence-based solutions can reduce gun violence in our nation. Connecticut, though, has demonstrated that this issue should not be partisan whatsoever. And we spent a few days in Washington, D.C. with Kristen and Mike Song and Melissa from CAGB, And we met with Republican members, many of them in their congressional offices, and we all agreed that safe storage practices are a requirement for responsible gun ownership. But where it stops is the gun lobby influences. And when Representative DeLauro introduced the bill this week, this was the response from the NRA. They in fact said, okay, I want to read this because this is important. There is no scientific evidence that government-mandated one-size-fits-all storage schemes reduce juvenile accidental firearm deaths or suicides. So while they claim that there are no scientific research, they have worked to make sure, right, that there won't be any research. So it's just incomprehensible that they would take this type of stance when on their website they're promoting safe storage. So we know it's all a baloney, so we're going to continue to work with our partners here and our partners on Capitol Hill. And we'll make sure this gets done because we are definitely on the right side of history. So thank you so much for your leadership.
Thank you. Thank you. I would like to ask Kristen Song to say a few words. I really would, because as I said at the press conference a few days ago, the courage and the dedication, and the two pieces that have come together for both Mike and Kristen Song in the midst of the tragedy of their lives has had a profound effect on legislation and where we go with both legislative action and cultural change and making a difference. The power of the issue is so internalized by both Mike and Kristen that they are devoting all of their time and effort to see that we have legislative success. And nothing breeds success like success, Kristen. And you succeeded, along with advocates, of once again allowing Connecticut to lead the country in legislation. And you are going to have that same profound effect in the United States Congress. Please, Kristen, say a few words.
Thank you so much. I will say that one of the things that has made an incredible impact on me is that courage is partly standing up and speaking out against what you feel is wrong, but just as importantly, courage is the ability to listen. And that is what Mike and I decided after Ethan died and we felt like we needed to do something, was that we sat down with people and we just talked like we are just talking at a coffee date. So I think that really helped move the ball forward in Connecticut, and I will say that we were so excited because in DC we went into some really conservative offices, and when they sat down with us and they just listened, we actually had some amazing conversations. So I'm very hopeful that it will pass in Congress, because I think that we all can agree that the NRA has spelled out beautifully how to safely store your weapons, and we're just asking them to take personal responsibility and to follow their own guidelines. So, thank you.
Thank you. Thank you so much. And I think what is critical in what Kristen said is listening to others, and that together both sides of the aisle can come together and pass this legislation at the federal level. And I think all we need to do is to refer people to the NRA's website, and you know what they talk about is safe storage, and that is all we are talking about here, is safe storage with regard to Ethan's law. I once again want to say a thank you to everyone here, especially those who were here the first time when we met at the New Haven PD to talk about this, but want you to know that the work of the hearings that we did in Washington, the work and the information you provided for us as we tried to move forward in passing the legislation in in this committee, subcommittee, and in the full committee, we still have to get to the floor of the House, which will be mid-June, and where I believe we will pass this appropriations bill, but then we go to the United States Senate. And once again, as everyone has, I urge the advocacy of everyone who is maybe listening. This is common sense. We had research with regard to smoking. We have had research with regard to automobile fatalities, all which has made a profound effect in saving lives. This is about saving lives. That's what it is, and I don't know of any other higher calling that we have at the local, state, and federal level. This research will help us to save lives, so thank you all very, very much. Happy to answer any questions from the press or anyone else. Hearing none. Okay, we covered the waterfront. Thank you. Thank you. Thank you, Janet. Great work. Beautiful. Whoa.